to uh, welcome Dr. Werber. Go ahead. Thank you, Dr. Werber.
Oh, thank you, David. Appreciate the intro. And Dr. Hertog, that was marvelous talk. Very much appreciated and very insightful. I'd just like to thank the coalition, Jim Stroll, and the group for putting this all together and giving me the opportunity to walk us through the progression from where we started with platelet-rich plasma through where we are today, moving from platelet-rich plasma, shockwave therapy, to thinking stem cells were the ultimate answer, to now looking at the functionality of the intracellular messengers, the exosomes or extracellular vesicles. If you'll give me a few moments to walk you all through my little progression of time. We started in the 80s and having a little challenge. Oh, there we go. Back in the 80s, we were looking at platelet-rich plasma, taking the patient's blood, spinning it down, and we would activate it, and we were seeing some significant improvements in wounds. And we were mostly focused on how do we prevent patients' amputations. That was our goal, was to reduce the amputation rates, especially in the diabetic vascular type patients. And like I said, we had some success, but now as we've progressed through the years, we then looked at placental tissue, and we're going to talk about how we go from using placental membrane, placental amniotic fluid, and all of the components that helped develop a beautiful, healthy baby, and how we can redirect those to help us with anti-inflammatory issues, multiple disease, trauma, wounds, and the like through the 80s. What we did find was that platelet-rich plasma, when we mixed it with shockwave therapy, an acoustic wave or even a vibratory wave, we were able to improve the outcomes of the PRP and be able to close wounds fairly rapidly, but still quite a bit of inconsistency. Some patients responded extremely well, others not so much. Now, some of it, like Dr. Hertog spoke about, is we really didn't have a good idea of the peptides and some of these other tools we now have to bring to bear in these patients in helping to control their glucose levels, but also to enhance their immune response to fight off the biofilm or the abnormal colonization of bacteria that develops in these horrible wounds that lead to amputation. So we found tremendous success. We modified our procedures, and then in 2000 or so, I came across placental tissue. And initially, we were using the sac, the amniotic membrane, and we had some success. But then when we were able to break down or cryofracture the amniotic membrane and mix it with the amniotic fluid, and take the proteins and from the amniotic fluid and mix them all together, we were able to now close these very poor healing wounds. This is an example of one of the studies we did. 3-year-old wounds, non-healing, patients facing amputation. We injected around in the healthy tissue, and 63 days later, we closed all of these patients' wounds. We were able to do this for all 20 patients. We found that none of the 20 developed secondary wounds. Their neuropathic, or their loss of sensation, that improved also. Didn't go away, but it improved. Their ability to sense the difference between hot and cold, and their vibratory response also improved. And this set us on a course to develop further iterations. Now, originally, we thought that it was only the growth factors and the stem cells that were doing the job, because we would see in a vascular wound or in a patient who had a loss of circulation, we thought, oh, it's the stem cells helping build the new circulation, but weren't sure. We still were groping in the dark quite a bit, because what we would find is when we injected this injured area, the opposite extremity. So let's say this was on the right side, the left side would circulation would improve at the same rate as the right. And so we're like, well, how is this at all possible? And so our research continued, and we found articles such as this one about parabiosis, where the old mouse was given blood from the younger mouse, and there was improvement. We also did a study. We made formulations without any cells, with no fibroblasts, no mesenchymal stem cells, and we found that that acellular mixture worked just as well as did our cellular mixture for those type of wounds. So this was pretty incredible findings. And we said, well, how has this happened? So we did an experiment. We tagged the proteins in the amniotic fluid, and we injected it into this poor little mouse who was sleeping. We did a sternotomy, and you can see from the color along the mouse's chest that the localization of the proteins went to the trauma. We then induced a heart attack, a myocardial infarction, and you can see where there was cellular death, that we had an expansion of all of those growth factors to the extremities. Wherever there was a loss of nutrient, oxygen, and circulation, we had an uptick in the take up of our amniotic fluid proteins. So that started, and combined with some of the knowledge we obtained from Dr. Arnie Kaplan at Case Western Reserve, where he started to report that no, it wasn't really the stem cells converting into specialized cells, but it was more that the stem cells were acting like small pharmaceutical factories, that the stem cells were producing these growth factors, microRNA, messenger RNA, and so we had one portion from the stem cell. Then we found that the stem cell also was producing factors to become immunomodulating, or be able to control your immune system. And so now we're saying, well, how is that all working? And that has brought us to the point where we talk about exosomes. So we have these exosomes, which are like little balloons, and they come off of the cell, and they're filled with different cargo, if you will. And so the cargo is made up of the growth factors, peptides, the hormones that we heard about earlier, the messenger RNA, some DNA in some cases, and they come off of a healthy cell, if you will, like a donor cell, or a healthy functioning cell, and they drift and they respond to the inflammatory chemicals or inflammatory interleukins. These are proteins that are like signal flares, and they respond. And they, like, we can use the example of Hansel and Gretel. They laid the breadcrumbs. Well, these inflammatory interleukins lay the breadcrumbs for the healthy exosomes to follow to the injured tissue. And so we now can think of those exosomes as being the Home Depot, if you will. They're bringing the Home Depot to the injured organ, system, skin, tendon, you name it, wherever the injury is. That Home Depot, now those intracellular messengers are saying, okay, I need 1 or 10 of these different microRNA that you see on your screen here. And each of these microRNA carry different instructions so that we can see the cell repair itself, or say, okay, I need more melatonin molecule, or I need more of the thymosin, or I need VEGF, or any of these growth factors that work in our system. And there's well over 1,500 growth factors that are part of how we function. And so it's these microRNA that are in the cargo of those exosomes that help drive and upregulate our regenerative capability and response. So let's go, what else? So let's look at one or two of these microRNA. What do they do? So in the COVID world, so we're all very worried about COVID and how we can try to reverse its effects. So we have in our exosomes derived from the amniotic fluid, the fluid the baby is floating in, we have 146A and B. Now this is very powerful, as evidenced in this article and many, many others, of how powerful it is to make the endothelial tissue, or the part of the lung where the blood is carried, what is destroyed in the COVID, stronger. It helps regulate that, quote, cytokine storm, but it also regulates the functionality of the airway, our airways, our bronchioles, the parts of the lung that help us breathe and exchange oxygen. And so we have this very powerful microRNA within that solution to help not only fight off a COVID, but for a bigger portion, we worry about COPD, chronic obstructive pulmonary disease. And so that same mechanism that helps with COVID also helps with COPD. Now, why? Now, we talked about, Dr. Herzog spoke about the I'm having a little word there. Surfactant. Anyway, sorry. But what we're seeing is that the baby, when we're developing in utero, we're breathing in this amniotic fluid, and it's carrying these microRNA, these exosomes, these extracellular vesicles, and it is helping us, our lungs, develop to be able to be fully functional. And so when we can administer these exosomes to the injured lung tissue, we see that we can rebuild the tissue very quickly and very rapidly with no adverse events. Here's another, just a very quick, another article about COPD and amniotic exosomes having a very pro-regenerative effect, anti-inflammatory, very positive in upregulating the immune system, but also upregulating the regenerative capacity of the lung tissue. So now let's look at longevity. How is longevity playing a piece in this, or how are the exosomes playing a piece? So we have several, and these are all very recent titles, medical literature, peer-reviewed over the last 2 to 3 years, talking about how the extracellular vesicles are playing a part in the different pathways that help our body function. All right, so we have different methods of how the cargo of the exosomes and the different cargo, and we look at the sizes. So if these exosomes are extremely small, 50 nanometer to typically 115 nanometer, cover the healthy functional cargo that we want to see in using exosomes that are very functional in regenerating tissue. When we start to see the larger exosomes, we don't get as much of a physiologic effect, and sometimes they're carrying biomarkers that or disease markers that we want to minimize. So we want to look at how these what the cargo is, and this is a determinant of how much we can help the part of the cell called the mitochondria, the energy cell, regenerate. And so as you can see in this slide here, we see that the donor, the healthy, will bring to the recipient cell or the injured cell the appropriate components to drive a regenerative healing. All right. So this is a new age, if you will, as we drive forward. We've moved from just taking people's blood and trying to release the growth factors to looking at stem cells, but now looking at the components of the stem cells that are driving forward the actual communication or intracellular communication from one cell to the other to help us enhance our functionality, but also to heal our injuries, tendinopathies, golfer's elbow, tennis elbow, osteoarthritis of the knee. And it's how we apply these biologics is not only the dose, but in how we put them into the recipient's body or into the patient's body. Is it supposed to be IV, IM, periarticular? And it really depends on the pathology we're talking about. So let's say for heart disease, post MI, all right, myocardial infarction, a heart attack, we want to make sure that we can do this IV, that we will get enough circulation, we'll get enough of the exosomes that will respond to the inflammation or the dysrhythmic area of the heart, the part of the heart that has been injured. And so we want to get this microRNA 294 through the venous system. Now, sometimes we may need, if they have severe, let's say, congestive heart failure, where they really can't pump enough blood out, then we may want to do a surgical procedure to put these exosomes directly into the center part of the heart to get the maximum functionality and improve the heart's ability to push blood out or pump the blood around our bodies. So very interesting technology. It is evolving. It is going to be helping us with regenerative therapy, and also to focus and be a participant in the regenerative functions of our body. So here's a quick example where we use a periarticular. We inject the exosomes around the joint, not into the joint, but around the joint. And we can see here, very limited, you can see the scowl, very limited range of motion on this patient's shoulder. And then 36 hours after injecting into the surrounding muscle of the shoulder,
Doc, watch this.
you can see a smile, but look at the incredible change in the range of motion. He's now almost a year and a half, 2 years, one treatment of exosomes, with a spectacular outcome. And this is very typical, but it's how we apply it. In this case, we use shockwave or extracorporeal shockwave therapy to stimulate the signaling. And then we use the exosomes to drive the healing process. How about scarring? All right, so here we have a not so good looking belly scar. And we use some radio pulse therapy or like shockwave therapy. And now you can see how the scar remodels in just 6 weeks. That skin remodeled itself in 6 weeks. And that is the power of these exosomes, these extracellular vesicles. How about keeping young by growing hair? I'm not a good example, but here's a few examples of hair growth, men and women. Women, it's obviously more of a issue than with men. But Dave and I have chosen the bald pathway, but certainly these other gentlemen maintaining their young, vital appearance by regrowing their hair. We have efficacy in dealing with facial wrinkles without adverse events. We can see how by using microneedling techniques and these exosomes, we can, over the course of a 6 to 8 week period, reduce the wrinkling effect, improve the collagen, improve the turgor of the tissue of the face. And so all very powerful examples of how exosomes work. We don't need the stem cells. We don't have to worry about any potential graft-host reactions that may occur with some of the stem cell preparations. That is all avoided in using the exosomes. There are no HLA antigens, human leukocyte antigens, that could possibly cause a graft-host reaction or an allergic type reaction or an inflammatory reaction. And quite the opposite occurs. It has a significant anti-inflammatory effect. So we at Thrivel have certified GMP laboratory. We have science staff. We have well over 20 years of experience. In my case, 35 years of surgical experience, but mostly we bring the clinical experience with the science to the table so that we really can understand the mechanisms that allow the tissue to be regenerated appropriately. I hope that gives you a good story from PRP to exosomes, and happy to answer any questions.
Great.